Okay, I know this has been kind of a hodgepodge of different videos so that you can kind of get this end of the Unit 1 Part 1 notes, but I don't have a complete recording, so this is the last little part that is not covered in those first two videos. So one thing that is not covered are these two location reference terms, cranial versus caudal. We won't use these very often. They're really used in terms of anatomy. They're used maybe by like a chiropractor. If you were a vet, you would use them more often. What it's talking about is cranial as in, remember, in relation to each other, closer to the head region versus caudal, closer to the end of the tailbone region. So sacral, we haven't learned that yet. That's just the end of your vertebral column. And so you can see like in an animal how that makes sense. Like, are you talking about something that's closer here to the head or towards the end of the tailbone, the backside, the end right there. If you were a chiropractor, then yes, are you talking about you have like issues closer to the head region or closer to the bottom of the vertebral column down here. So like I said, you won't use it very often. As long as you know cranial towards the head, caudal towards the bottom of the tailbone, then you're good to go. The next set of terms that is not discussed in those other videos is proximal versus distal. This one is one that can be confusing. The key here is that you're talking about point of attachment. You have to always reference these two things in relation to a third thing. Unlike all of these other terms where you're like above something or below something, so you're just in relation to each other, here you're in relation to each other, but compared to a third thing. So a point of reference is going to be the point of attachment. So let's think about arms and legs. Where does your arm attach? So where does your arm attach? It attaches here. So when you're talking about two body parts in relation to this part here, that's your point of reference. So let's talk elbow versus wrist. So elbow versus wrist, you're comparing them to each other, but in relation to who's closer or who's farther away from your point of attachment. So if you're right here, this is the point of attachment, which one is closer, elbow or wrist? Obviously the elbow is closer because the wrist is down here. So therefore your elbow is proximal to your wrist. Your wrist is distal, like more distant to than your wrist is distal to your elbow. Let's try getting that in a sentence without tripping myself up. So they're in relation to each other, but in your head, when you're trying to determine who's proximal, who's distal, you have to think about and compare them to that point of attachment. So anytime you're talking about arms or legs, and those two body parts are on the arm or the two body parts are on the leg, it's going to be proximal distal. You're not going to talk about superior versus inferior. You're always going to use proximal or distal if it's an arm or leg and those two body parts are on the arm and or on the leg. So let's look at the leg. In your leg you have ankle and toes. So what if I said the toes are blank to your ankle, what would you say? The toes are distal to the ankle. The ankle is proximal to the toes. The ankle is in closer proximity, closer to the point of attachment, whereas the toes are distal, more distant from the point of attachment. So toes are distal to the ankle is proximal to the toes. So if you're having troubles with these two, please let me know right away so that we can come up with a couple of other examples and I can give you like a verbal mini quiz just to see if you get it. All right, so that's proximal versus distal. Plantar versus palmar are also in our notes, and plantar just means pretty much on the bottom of your foot, the sole of your foot, and palmar just means on the palm of your hand. So not necessarily in relation to each other. Where you hear these terms are like, for example, like for warts, there are plantar warts or palmar warts. Plantar warts are on the sole of the foot. Or maybe you know somebody who has intense heel pain, like if their heels hurt really bad, or they wake up and they step on it, just feels terrible. That can be plantar fasciitis. So on the bottom of your foot, fascia is the type of tissue, that's this tissue you see running through the bottom of the foot. Itis is inflammation. So you have inflammation of the fascia on the bottom of your foot. So that's what that is talking about, on the bottom of your foot versus the palm of your hand. We have one more set of location reference terms, and supine versus prone. This is your body position basically. So are you in the supine position or are you in the prone position? So supine just means you're like laying on your back, basically. So if you're a back sleeper, you're sleeping in the supine position. If you're a tummy sleeper, you're sleeping in the prone position. But other body parts can be supine or prone also. So like, for example, your hands. Let me see if I can get my hands in here. So my hands are facing up, so the palms are facing up, so they're in the supine position. Or their hands are now facing down, palms are facing down. That is the prone position. The reason why you might be wondering why there's this weird little bowl of soup over here, this is how I remember supine versus prone. Somebody shared this with me and it like stuck in my head. So if you wanted, you push your hands like you cup them like they're a bowl of soup, right? So you're like, soup, soup, soup. You have soup in your hands. This is the supine position. So obviously I have it more in the cupped. It's like make my soup bowl out of my hands, but this is supine, making my soup bowl soup. And then therefore the other position is prone. So if I remember my bowl of soup, then you'll be good to go for supine. So those are the location reference terms that are not in the other notes, but we also need to go over 4 movement terms. So in this first unit, we're just going to learn the most basic abduction versus adduction and flexion versus extension. Once we get into unit 3, we're going to like really dive back down into this and like get a lot deeper. But for right now, we're going to keep it as simple as possible. So here, keep an eye on your roots. Your root terms are coming in here. So abduction, away, add, to or towards. And so where are your arms or your legs? Like what is the body part doing? If you're moving in an abduction movement, then that body part is moving away from the midline of the body. So the midline is, your middle. So I'm going to like push my chair back and stand up. I'm not sure if you'll be able to see my face or not. We'll just try to like readjust down here. So here's my arm, my midline. If my arm is moving away from the midline, that is abduction. If I'm moving towards the midline, I'm taking my arm and moving it towards, that's adduction. So you really look at it as like a jumping jack. So when I go up, I am with a B, abducting my arms and legs. And when I come back in, I am adding them back to the body. So I think of it as add the limbs back to my body. So I'm moving towards the midline of my body. So abduction, adduction. So you can do that with the arm and the leg. And when you're looking at these diagrams, notice you're going to need to use the arrows to show movement since these are static pictures. So notice in this case here with the arm, so the arm was down here and now it's moving away from the body. So it's going up. So that is that's abduction with a B. And now you can follow the arrow. It's coming back toward the midline of the body. So adduction. Our last 2, extension versus flexion. This is really about the angle between the bones. For right now, the easy version is are you straightening or bending, but that's not always going to be, that's not the strict definition. And in unit 3, you're going to need to know this part over here. When you increase the angle between the bones, you're moving and making the angle bigger. That is an extension. So for example, if I start with my arm here, I have a bone here and I've got bones here. So this angle here, like if I was perfect, I'm like, oh, look, I'm 90 degrees. Now, if I make it bigger, so I have a bigger angle, a bigger distance, this movement is extension. And if I go the other direction and I make a smaller angle, so I go from 180 degrees, right here's my 180, and I go, now here you can see the distance is smaller, the angle smaller, 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 smaller. This is flexion. So if I told you to strike a pose like flex, you might be like, get your little flex muscles going on there, right? So you got your flexion, you got your smaller angle. Extension, flexion. Extension, bigger angle, flexion, smaller angle between these bones. So notice the arm is a very common example, but you could also see like at the knee, if you are sitting in a chair, listening to this video, maybe you're laying down, but pretend you're sitting in a chair, got your legs down, bent, at this 90 degree, if you were to move, like kick your leg out at the bottom, so you're going to have, this is the angle here. Oops, I don't want those little things on there. Well, I can't make that go away. So like here you have 90 degrees. And so I'm going to kick that bottom leg out. And so now it's back, here's the 180 degrees. So that's the extension. So let me see I'm going to see how flexible I can be here. All right. Leg. Oh, where's the video? I'm trying to find the camera. There we go. So we have small angle And if I go out, 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 that's the extension. Small, 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 flexion. Extension, flexion. So that's this angle down in here. And so that I will show you, or stick to these more simple versions of extension and flexion for now. But you can see they can be a little more complicated. How this is going to look on a test is, let's say you like this lady right here. Notice, look at the arrow. Here's her foot. Follow the arrow and it's going up, 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 and it's going to here. So what's the angle doing? So I'm at 90 degrees and her leg goes up, 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 up. And so now I'm at 180. So now this is extension. If the arrow was going the other way, coming down, then the movement would be flexion. Why you have to be careful and look at, well, what is actually moving at your, notice your leg has other movements. This is a bend at the knee. But what if you weren't bending at the knee? What if you were moving your whole leg together? Well, if you're just standing here when in this normal position and you bring your leg up, well, what's happening to the angle between your body and the leg? Here you have 180 degrees. And then as you kick your leg up, this is now a smaller angle. So now this is flexion. And when you take it and you go back further, notice this is bigger than 180 degrees. So that's extension. So the knee is a little easier to see than this big leg. If you need me to like demonstrate this for you, just let me know. Looking at this person here, last quick question, are they going through abduction or add with a D, duction? They're going away from the midline of the body, so this is abduction. All right, if you have any other questions, pretty sure, yep, that's it. If you have any other questions, make sure you reach out. Bye.